Hi, I'm Sarah Compton-Bishop. I'm Chair of the Board of NHS Highland. I'm doing this short video for you today just to bring a few highlights from our latest public board meeting, which took place on Tuesday, the 25th of March. So at the top of the meeting, we took a moment to think about the COVID Day of Reflection that took place earlier in March. Teams across the whole of the Highlands and Argyll and Bute marked the day in different ways that were meaningful to them. And we just paused at the start of the meeting to think about what that meant for all of us, to remember those that lost their lives, to consider the immense challenges and impact that the pandemic had on all of us, and to pay tribute to the absolutely astounding and enduring work that our teams across the whole of the health and social care sector, not just within NHS Highland, the work that the teams did caring for people, and of course the work that volunteers and communities and individuals did caring for one another. So that was a really meaningful way to open the meeting and give us pause for thought. We had a really full agenda, so I'm not going to talk about the whole thing, but just to pull out a couple of highlights. We took a paper quite early on in the meeting about collaboration. Now, this means collaboration in the sense of different NHS boards across Scotland working together across boundaries and borders to deliver services for people in the future in a way that uses all of our resources across the whole of Scotland to their maximum capacity. So really squeezing everything out of the services that we have and using them to their fullest. And by doing that, trying to deliver services faster for people and taking people to the right places for those particular procedures or services. Now, working collaboratively with other NHS boards is not new for us in NHS Highland. We do it all the time, particularly because of our geography and our rurality. So, for example, probably most of our patients in Argyll and Bute will have received some services and procedures in Greater Glasgow and Clyde. Other people across Highland will have gone to perhaps centres of excellence that exist across Scotland for specific procedures where those staff and the equipment and technology is honed to deliver those services in the best possible way. And in turn, we provide services for other health boards. So, for example, we take patients from the Western Isles for some services as well. So it's not new for us, but what this paper did was, following on from the intentions set out by the First Minister earlier in the year, really set to galvanise that collaborative working across the whole of Scotland to really make sure that we are using everything that we've got to deliver services in the best way possible and as quickly as possible. So that's still developing, it's still evolving, and we don't know the details yet, but it might mean that going forward we will be looking at sending people or asking people to go to places they haven't been to before for certain procedures or services, and that will mean that they have the option to potentially receive the treatment faster or to go somewhere where that particular service or procedure is their speciality. So we'll keep a watching brief on that, and we'll have lots of opportunity to feed into that from a Highland and Argyll and Bute perspective, because obviously it's really important that we consider our rurality, our island communities, our travel, all of those things as those plans evolve. We also took a whole suite of papers around masses of work that is going on at the moment in NHS Highland around equality, diversity and inclusion. Some of those papers were reports and data on how we're doing, and some of those were plans and intentions for the future. We're really delighted in the meeting to have approved our new EDI strategy. So that takes work that is already in place, but also sets out some intention for the future about how we can be more inclusive and really make sure that we are doing everything that we can to support equality, diversity and inclusion. And we also agreed some equality outcomes going forward. So thinking about what it is that we're trying to achieve, how will we measure that, how do we know that we're doing a good job? It was a brilliant discussion, really, really interesting. Lots of talk about, you know, both how we're doing at the moment and how that, you know, how good that is or where we need to improve, but also really thinking about the future and really considering how that crosses lots of different bits of our work and things to be considered. So that was a great conversation, really rich. And the other thing that we talked about and had a great conversation about was our corporate parenting. So corporate parenting, lots of organisations are what you would call corporate parents, which is where we have the privilege and the responsibility of being the corporate parent for children who are cared for. Really quite complicated governance around corporate parenting and children who are cared for obvious reasons. So we had a really interesting conversation about how we can get better visibility of that, how we can really make sure that we are delivering against, you might have heard of something called the promise. So how are we as an organisation, as corporate parents, really trying to meet those plans and drive that forward? And that was really, really rich. And obviously we do that in partnership. We don't do that alone. We do that in partnership with the Highland Council, and lots of that kind of work goes through the community planning partnership, and the third sector have heavy involvement as well. So it was a really good conversation about how, you know, we work effectively with our partners to make that better for children who are cared for, and how from a governance perspective we get the right kind of visibility as corporate parents to make sure that that work is happening as it should. So a really interesting board meeting. It gets recorded, it goes up on our website if you want to watch bits of it or all of it, and we'll see you again next time. Thank you.